பாக்குறேண்ணா, இருங்க ஒரு நிமிஷம்.
Zeb-Don50 is now connected.
அது தம்ப்நெயில் மட்டும் தெரியுதுண்ணா, லைவ்னு காட்டுது. இருங்க இருங்க, இவன் ஸ்கிரீன் தெரியுது, ஸ்கிரீன் ஷேர் பண்றாங்களா மெட்மேஸ்ன்னு சொல்லி அது தெரியுது.
ஆமாண்ணா அதான்.
ஆமா அதேதான் அதேதான். ஓகே ஓகே ஓகே, கரெக்டா இருக்கு.
சத்யா ஸ்கோர் வீடியோ ஓபன் பண்ணிட்டியா?
ஓபன் பண்ணிட்டேன்.
ஓகே.
இப்ப அனுப்பிச்சிருக்க மெசேஜ் ஓகேவான்னு பாருங்கண்ணா டிஸ்கிரிப்ஷனுக்கு. அது ஓகேவா? நவீனும் நீயும் பாத்துரு. Do you knowன்னு வரணும்ல, எடிட் பண்ண வேற.
இருங்க எல்லாரும் ஜாயின் பண்ணாது போட்டுக்கலாம்.
அதுக்கு எதுக்கு போகணும்ண்ணா? லிங்க் முன்னாடியே ஷேர் பண்ணிக்கலாம்ல ஆரம்பிக்கிறதுக்கு முன்னாடியே. ஓகே ஓகே, லிங்க் மட்டும் இப்போதைக்கு ஷேர் பண்ணிடுவோம் கம்யூனிட்டிஸ்லாம். இப்ப என்னன்னா, இந்த ஸ்கோர் போர்டு நடுவுல மாத்தி காட்ட முடியுமா இந்த இன்னொரு அக்கௌண்ட்?
இல்ல, அதுவும் எண்களே போட்டு வச்சிருக்கேன். நான் என்னோட இதுல பண்ணிடுவேன்.
அப்ப யார் ஸ்கோர் எப்படி எனக்கு புரியல. நீயே ரெண்டுமே மாத்தி மாத்தி காட்டுவியா?
ஆமா.
அப்ப சத்யஜித் என்ன பண்றான்?
சார்
வந்து அந்த ஸ்கோர் போடுவான்.
ஓகே ஓகே, அது எப்படி அப்டேட் பண்ணி? நீங்க ரெண்டு பேரும் ஒரே இடத்துல இருக்கீங்களா வேற வேற இடத்துல இருக்கீங்களா?
சார் கூகுள் ஷீட் வந்து லிங்கா இருக்கா சார் ஒரே அக்கௌண்ட். ஸோ அதனால வந்து அவனுக்கும் தெரிஞ்சிடும் நான் போட போட.
அப்படியா?
ஆமா சார்.
பாத்துக்கோங்க. நெக்ஸ்ட் சரி, லிங்க் ஷேர் பண்ணி விட்டுருவோம் 5:30 எல்லாரையும் வர சொல்லி. என்ன ஆச்சு? எனக்கு ஒரு போன் கொடுக்குறேன்.
ஐயோ, நான் இந்த பேஜ் வர போறல. ஜோதிகா ஹலோ, கேட்கல சரியா.
ஹலோ கேக்குதா?
ரொம்ப கம்மி வாய்ஸ் கேக்குது. நான் அந்த இன்ஸ்ட்ரக்ஷன் ஸ்லைட் போடல, நீங்க அப்படியே பேசிருங்க.
இன்ஸ்பெக்ஷன் ஸ்லைட் போடலையா?
ஆமா.
சரி
ஹலோ,
எனக்கு வந்து பிபிடில அது ஏதாவது திரும்பி ஸ்க்ரீன்ஷாட் அனுப்பி கொடுத்தா.
இல்ல இன்ஸ்ட்ரக்ஷன்னா இந்த ஜெண்டர் இன்ஸ்ட்ரக்ஷன் இருக்குல்ல, இந்த மாதிரி எல்லாருமே ஓபன் பண்ணி வச்சிருக்கணும் அந்த மாதிரி.
ஓகே ஓகே சரி. எல்லாத்தோட வீடியோ ஆன்ல இருக்கணும். ஓகே 1 பற்றி ஆன்சர் பண்ணணும். அதுக்கப்புறம் 2 டைம்ஸ் கால் பண்ணுவோம். எல்லாரும் வித்தின் டைம் லிமிட் ஆன்சர் பண்ணிடணும். ஆளுக்கு ஒரு ஆல் ஆன்சர்ஸ் ஆர் ஃபைனல் அக்கார்டிங் டு த ஆர்கனைசர். அவ்வளோ பண்ணலாம். அதுதான் சொன்னேன். ஃபர்ஸ்ட் பாயிண்ட் எல்லாத்தோட ஆடியோ வீடியோ ஆன் ஆடியோ ஆன் இருக்கும், ஒரு வீடியோ ஆன் இருக்கும். Network problem ஏதாச்சும் இருந்துச்சுன்னா we are not responsible. Only one person per team should be answering all the questions.
ஹலோ,
சொல்லுங்க.
நீ தான் ஃபர்ஸ்ட் ஸ்டார்ட் பண்ண போறியா? சரி, voice clear ஆ இருக்குதா பாரு. என்ன
ஓகே
இங்க ஆளுக்கு பேசுற மாதிரி இருக்கு.
பரணி அண்ணா, இது நம்ம லிங்க் போடுங்க.
இதான் நான் போறேன்டா.
அண்ணா இப்போ வாய்ஸ் ஓகேவா? Mates have joined. Team champs, is Navyashri here?
Ratnam and Nayashi both have joined together.
All right. Good evening, all. I request Team A, tired of trouble, to kindly raise your hand. All the team members, kindly raise your hand. Thank you. Team B, Coldplay tickets available. Kindly raise your hand. Malhar, you can put your hand down. Thank you, Team B. Team C, Men SX, please raise your hand. Thank you, team. Team D, Jai Mata Di, please raise your hands. Thank you. Team E, Champs, can you please raise your hand? Ratnam and Navya are together, right?
Yes.
Yeah, thank you. Team F, Ames Raipur, can you please raise your hand? Thank you, teams. Okay. Good evening, everyone. Thank you all for coming. With a lot of excitement, I welcome you all to Medmaze Endocrinowiz National Level Medical Quiz presented by Agam. Firstly, congratulations to all the finalists here. I would like to take a moment to speak a few words about Agam. Agam is a student-run non-profit organization committed to connecting fellow medicals beyond the curriculum. We at Agam provide extensive platform for learning, interacting, inspiring, and enriching ourselves to become dependable pillars of the future healthcare system. And Endocrinowiz, and I'm proud that this is our third grand academic event at Agam, connecting the brightest minds all over the nation. I request all the teams to kindly turn on your videos. I request all the team members to kindly turn on your videos. Okay. There are exciting prizes for our winners. The first prize winners will get a cash prize of 5,000 rupees. Runner-up team will receive 3,000 cash prize, and the second runner-up will receive 2,000. We also offer exciting gifts from books sponsored by JP Publications. Also, we have a surprise for the audience today. At the end of each round, audience will get a question and they can answer those in the live chat. Coming to general rules to all the team members, all the teams kindly pay attention. Participants, your video should be on at all times during the quiz. Finals will consist of 8 rounds, and the rules for each round will be explained by the quiz master before the starting of the round. Any doubts regarding the round should be clarified before the round begins. And teammates can discuss the answer in the meet, but only one person from one team should answer the question, and that answer will be considered final. Scoreboard will be shown after every 2 rounds. Decision of the organizing team is the final one. Team should ensure good network connectivity, and any lag due to network issues will not be considered. All the best, teams. With the next 5 minutes, we'll proceed with our quiz. So, all the best, guys. Okay, I would like to repeat the team codes. Kindly make a note of this. Team A, Triad of Trouble, Dabayan Banerjee, Malhar Deshpande, Mohak Agarwal. Team B, Coldplay tickets available, Yash Ratwani, Gagan Periwar, Henil Patel. Team C, Men Essex, Nishit, Dhruv Darji, Prajapati. Team D, Jay Matadi, Tejas Shekri, Priyanshu Jasija. Team E, Champs, Navyashri Shah, Ratnam Shah, Pratham Shah. Team F, Ames Raipur, Medansh, and Somnath. Please make a note of your team codes. Participants, I repeat, the video of all the participants should be on during all times during the meeting. And only one person from each team should be answering. You can discuss the answer, but only one person should answer, and we will consider it as a final one. Right, without any further ado, I would like to start the quiz Endocrinowiz. Okay, fine. Hope all the participants are clear with the general instructions. We'll have 8 rounds. Moving on to the first round, connections. We have rules for the round. There are total 6 questions in the round, and each team will get 1 question. We'll have 3 to 4 images per question depicting clinical feature or sign. The team has to connect all the images to arrive at the desired answer. We will give you a clue if you need, and there are 2 passes allowed for each question. Next slide, please. Time limit for each question is 45 seconds. If the team is able to find the answer without any clue, you will be awarded 10 points. If you open the clue, we'll give you 5 points. And if you are able to answer every image in that, Debayan, please pin Medmaze Agam and you'll be able to see the PPT. I mean, you'll be able to see this screen which is being shared. Debayan, please give me a thumbs up or some voice note so that I can proceed further. Right. So if you answer all the images in the question, you will be awarded 10 points and half of the marks will be awarded for the pass. And there is no negative marking for this round. Decision by the quiz masters will be final.
Passes is maximum up to
Excuse
2
me.
teams means if
2 teams.
okay. निशित
Okay.
सर आप पूछ लो.
हाँ मैंने
Any
पूछ
other?
लिया.
Will there be an option of pouncing?
Option of?
Pounce.
No. No. Do we have any other questions from the participants?
For pass, we do not have image explanation marks.
For can you please repeat?
पास हुआ तो इमेज एक्सप्लेनेशन के मार्क्स नहीं है.
No. Only for the first team we are giving marks. Hope there are no more questions. Yeah, you have a sample question here. All the participants, you can try to find out the answer for this question. Can we have the question on the screen? Yeah, your time starts now. You can for this sample question, no marks will be awarded. If you request for a clue, we will be opening the clue for you. Okay. Yeah. This is how we want you to answer. We want the answer for the image and each point explaining all the images in that question. Hope you all got it. Hope it's clear for everyone. Everyone, please give me a thumbs up so that we can go further. Great. Okay. So, Team A, which flower do you want to choose? And this concept of flowers is completely to randomize the question. Neither you know which question is behind each flower or I do know. Team A, please choose your flower and there is a question behind each flower. Team Triad of Trouble.
कौन सा लेना है?
Rose, rose.
We'll go with rose.
Okay. And the question is, Team A, your time starts now. You can request for a clue.
No, we don't need the clue. अरे OCP का साइड इफेक्ट लग रहा है ये सारे.
यस
हाँ
यस
डीबीटी लग रहा है.
डीवीटी है, गॉलस्टोन
गॉलस्टोन्स है, हेपेटिक एडिनोमा है,
हिपैटिक है. हाँ
और वो सर्विक्स वाला शायद कैंसर है, शायद उसमें कॉन्ट्राइंडिकेटेड.
हाँ.
बोल दूं?
लास्ट वाला इमेज
लास्ट वाला उसका हिस्टोपैथ लग रहा है, हेपेटिक
हिस्टोपैथ है. हाँ हाँ ठीक है.
बोल देता हूँ.
हाँ हाँ.
Your time.
Yeah, we want to answer.
Yes.
So the connect is that all of these are side effects of oral contraceptive pills.
Okay, so the drug is?
OCPs.
Can we go to the answer slide? Would you like to give explanation for each image as well?
Yes. So the first image is gallstones. The second image is the DVT. And the third image is hepatic adenoma, and the fourth is any cancerous lesion. So in all of these conditions, OCPs are contraindicated. And
Great, congratulations team, and you'll be awarded full points for this question. Can we go back to the flowers slide? So team A, you get a total of 20 points for this question. 10 points because you have found the answer and 10 points because you have explained every image in that question. Congratulations. Team B, which flower would you like to choose?
Sunflower.
Sunflower. Can we go back to the question? And here is your question. The time starts now. Team B, would you like
Pendred
to
syndrome.
know the clue?
Pendred syndrome.
Is that the final answer, or would you like to discuss with your teammates?
Yes, final answer.
Great. Would you like to explain the images?
There's SNHL, there's a goiter, there's a chloride channel defect.
Okay, the other image?
Sorry?
There are 3 images. Can you please explain all
Yeah,
the
there's
3?
one SNHL, there's one goiter, there's a iodide chloride channel defect, transporter defect. There.
Great. Congratulations, team. Can we go to the answer slide? Team B, you get a total of 20 points for this question. Congratulations. Can we go back to the flower slide? Team C, which flower would you like to choose?
Marigold.
Marigold. Let's see what's the question behind this slide. And your question is, time starts now. Team C, would you like to know the clue?
Yeah, the answer is WDHA syndrome, Werner Morrison syndrome, watery diarrhea, anhydrosis, watery diarrhea, and achlorhydria, hypokalemia.
Nice.
First, potassium is hypokalemia.
Okay. Can we go to the answer slide? Congratulations, team. You get a total of 20 points for this question. Team D. Can we go back to the flower slide? Team D, which one would you like to choose?
Lotus.
Okay, let's see what's the question behind this flower. Can we see what is behind the lotus? And your question is, the time starts now. I request all the participants to put your video on during all times during the meet. Team D, would you like to have a look at the clue?
Is it IgG4 related disease?
If you want us to open the clue, we will.
I've answered. Excuse me, am I audible?
Yes, you are.
I said IgG4 related disease.
Can you be more specific? We need the proper diagnosis, not a vague answer. Would you like to rephrase it?
Excuse me, could you please repeat what you were saying?
Okay, your time is up. Would you like to rephrase your answer? Be more specific with your answer.
There is storiform fibrosis, retroperitoneal.
Sorry, team. Your time is up. You have almost landed at the answer, but your time is up.
Hormones disease.
Your time is up, and this question will now be passed. Just a minute. Any team who knows the answer, who raises their hand first, will be able to answer. Okay, it is. One second. Pratham Shah, who raised their hand first. Pratham Shah from Team Champs. Would you answer?
Ma'am, it would be Riddle's thyroiditis.
This is a wrong answer. Pratham Shah. Second one was Ratnam Shah. Sorry. Sorry. Pratham Shah, what is your answer?
It is Riddle's thyroiditis, stony appearance of thyroid gland, stony consistency, and the follicles. Can you please unmute my teammate as well?
Your teammate can unmute themselves. Okay, would you like to explain all the images? We'll go to the answer slide.
ચાલુ તો કર અને કરવા લાગે explain પેલું goiter છે ને એ બધું. અરે riddles છે એ હા પાડી એને. તું કર ને ફટાફટ ચાલુ કર.
Okay, fine. Team E.
Yes, ma'am, we are explaining.
Yeah.
So basically, there is a thyroid mass. The stones depicts the stony appearance, which is seen in the Riddle's thyroiditis due to fibrosis. So basically, the answer should be here Riddle's thyroiditis.
Great. Congratulations, Team E. You get 5 points for this answer. Right. Can we go back to
excuse
the
me?
Yes.
You said that the question will be passed. Then why is this thing of raising hands now? You should just pass it to the next.
Yeah, exactly.
Exactly, you said to
Same
it will
doubt.
be passed to 2 teams.
Even if it would have been passed, the next team was already Team E.
That is fine.
That's okay, but
Okay, fine. Fine. Sorry. We'll be following our rules. Sorry for this mistake from our side. So anyhow, it was Team E to whom the question will be passed. Okay. So Team E, it's your question now.
Hibiscus.
Okay. Let's see what's behind hibiscus. And your question is, time starts now.
DI છે. આ didmoid નથી ને? આ didmoid જ છે. હા.
Would you like to see the clue?
Ma'am, we are answering. It is Wolfram syndrome.
Okay.
Also known as Didmoid syndrome, diabetes insipidus, then diabetes mellitus, optic atrophy, and deafness.
Great. And you have completed before the time limit. Congratulations, team. You get a total of 20 points for this answer. And can we go to the final question for Team F? Team F, your question is, Team F, your time starts now. Team F, would you like to have a look at the clue?
Yes, can you please provide us with the clue?
Unfortunately, team, your time is up. Here is your clue. You can answer within 10
Is
seconds.
it diabetes? Diabetes.
Can you be specific?
Diabetic nephropathy. The first image shows the third one shows the diabetic retinopathy, and the first one is the diabetic neuropathy. I mean the loss of sensation at the periphery.
So the complications of diabetes mellitus.
Complications of diabetes.
Great. Can we go to the answer? Right, that's the right answer, Team F. You get a total of 15 points for this. Yeah. Congratulations.
Excuse me.
Yes.
See, you allowed them to answer after the time was up. Even I gave the answer Riddle thyroiditis afterwards.
This is a past question.
No. Let me answer. They started explaining the images and they answered. They told diabetes. I asked them to be more specific. That is when they answered, like explained every picture. But by the time you answered, you completely crossed the time. Hope I'm clear with this point.
Okay.
Yeah. Any other questions or queries from the participant side? Okay. Now we have a question for the audience who are watching us live on YouTube. Audience, here is your question. You can answer this question in the YouTube live chat. Yeah, audience, this is your question. Connect the images so you land up with a disease or a sign or a drug. Participants, this is for the audience. Even if you're guessing, we are not giving any points, but you can still guess it. Okay, so we have Ankit Tatwa from the audience. The answer is Cushing syndrome. That's a great one. Congratulations. So teams, let's move on to our second round. Yes. Yeah, so teams, there will not be any mistake from our side in the further rounds. All the rules will be explained before the round starts, and we will strictly stick to our rules. If you have any doubts or any questions, any problem, you can raise your hand and put it forward there. Okay, before we go on to the next round, Devyan sir, do you have any memorable anecdote from your med school? Funny, memorable one would you would like to share with all the participants and our audience?
Well, nothing like very specific, but we see a lot of things during our postings, and we read the file, and I happened to read the file of one patient, and it said that mitral stenosis, but when I presented the case to the head of unit, he told that no, it is not mitral stenosis, it cannot be mitral stenosis, it was mitral regurgitation. So I had actually first thought that it was mitral regurgitation, but I stuck to mitral stenosis because then I later found out that the resident had written it incorrectly. So I would always say that we should stick to what we feel is the correct answer, and the first hunch is always right. That's what I feel.
Thank you, sir, for sharing your experience. Yeah, we'll take a note of it. Right. Just give us a second. We will give us a minute. We'll proceed with the second round shortly. Okay, so we have two more audience who have answered our questions right. Username Lightspeed, congratulations. Anugula Sahaya, congratulations. Ankit, Lightspeed, and Sahaya are the fastest fingers for our first audience question. Right. Teams, hope everyone are ready for the second round. Yes. Moving on to our second round, clinical case. Here we'll be giving you. Can we move to the rules slide? Yes. So each team will be given a random case scenario, and you'll get 1 minute to solve each case. First question, you'll have two questions or two sets of questions for each case. First one will be a diagnosis for which you'll be given 10 marks, and the second one will be anything else related to this case, and it will consist of 5 marks. Okay, only if the diagnosis is correct. If you answer the first question right, we will show you the second question. And if the diagnosis itself is wrong, the question will be passed to the next team. It will be passed strictly. And for the past questions, the next team should answer within 5 seconds. If you fail to answer or if the answer is wrong, the second team will get the question. And it's the decision of the quizmaster and the organizing team which will be final. Do you have any questions? Yes.
Ma'am, the past question will be transferred to the next team or the one with will
Next
hand
team.
raise?
Next team.
Okay.
It's for the next team. And the timer on the screen is not working, unfortunately. We will be having a timer from our side, and exactly after 1 minute, we'll inform you that your time is up. Tejas?
Yes, actually, I had a suggestion. Instead of
Yes.
passing, could you open it for pounds and we could type it to a certain individual and then they could check our responses?
That's a really good suggestion, but unfortunately, the team has pre planned all the rules and we are not open to it right now. Thank you.
Instead of passing to the next team, can you just keep the hand one option? So like every team will get a fair chance.
No, it's actually pass to the next team. We are giving 2 passes. Pratham Shah, can I know what is your question? What's your query?
Yes, ma'am. Actually, in rules, it was written that it will be 5 marks each for the sub question. So, is it in total 5 marks or per question it is going to be 5 marks?
Okay, let me explain. You'll be given a case scenario. The first question will be diagnosis. If you answer the diagnosis right, you'll be given 10 points. Only if you answer the diagnosis, the second set of sub question will be shown. And if you answer it right, you'll get 5 points. If a team doesn't answer the diagnosis or gives wrong answer to the diagnosis, we will pass the question to the next team.
Okay, ma'am, I got it.
Right? Thank you. And if a team answers the diagnosis question right, and if they are not able to answer the sub question, that will not have a pass. Hope I'm clear. Somnath, what is your question? Yes.
Can you please remind like 15 seconds are remaining or 30 seconds are remaining, like something like that, so that we have a.
Sure. We'll inform you when there are 15 seconds left.
Okay, thank you, ma'am.
Right. Do we have any other questions from the participants? Okay. Let's go on to the questions. Ratnam Shah, Can I know what is your query?
How many marks one team will get if the question of pass is answered?
10 points.
Okay.
Sorry, it's 5 points. Half the point of the total question. 5 points. Okay. Any other questions? If there are no other questions, please give me a thumbs up. We'll go further. Right. So now the questions will be in reverse order. The first question will be for team F and the last question will be for team A. Is that clear? So team F, you go to choose the fruit first. Team F.
Ma'am, watermelon.
Okay, let's look at the question. What is behind watermelon? Your question. We will not be reading out the question for you. Once the question is displayed, your time starts. Okay? And here is your question.
Time starts.
Your time starts now.
Ma'am, hello, ma'am, am I audible?
Yes.
Ma'am, the type of cataract which you find is posterior subcapsular cataract.
Okay.
And the patient developed cataract because the hydrocortisone therapy which is given for Addison's disease. So that they interfere with the metabolism of the lens.
That's a great move, team F. That's the right answer. Let's go to the next slide. You'll get 30 seconds for the sub question now. Your sub question will be displayed now. Your time starts now. $15 seconds more. 10 seconds left.
Okay, ma'am. Ma'am, the same drug topically will cause glaucoma in the eye, and any four side effects like there will be immunosuppression and like osteoporosis. Like there will be more chance of infection, osteoporosis, and the patient can like systemic side effects. The patient can have diabetes mellitus, like preponderance of diabetes mellitus, hyperglycemia, and also there'll be there'll be delayed wound healing in the eye. Delayed wound healing of the and like there can be bull's neck, and like there can be moon phases, like if you use side effects.
Great one, team. And you'll get full points for this question. Congratulations. Okay. Next question to team E. Your time starts now.
Ma'am, question is not yet displayed.
Just a minute. Sorry for the inconvenience. So team E, can we go back to the fruit slide? Yeah. Team E, you can choose your fruit here.
Ma'am, will
Yes,
this
yes.
question be passed to team F or to team D?
I'm sorry?
Will this question of team E will be passed to team F or to team D?
Team D.
Okay, ma'am. Thank you.
So, Team E, which fruit would you like to choose?
We'll go with the pineapple.
Okay. Let's see what is behind the pineapple. And your time starts now.
ફેટ દેખવા મળ્યું છે ને ફેટ સેલ જોવા મળ્યા છે ને એમાં તો એડ્રિનલમાં તો કયા કયા હતા હવે પેલા ગણ
15 seconds left. Five seconds left.
Is it angiomyolipoma of adrenal?
Can you please repeat your answer?
Is it angiomyolipoma?
Angiomyolipoma. Just a minute.
હા શું કહે છે કઈ ચેન્જ છે ફીઓ તો ના હોય ને યાર
Yes, that's the right answer. Can we go to the subset?
ચાલુ રાખ તારો અવાજ
Okay.
3 to 4
Get 30 seconds for this question.
પહેલામાં 3 to 4 આવશે કે 6 to 8 આવશે ફટાફટ બોલવું પડશે રત્નમ
5 seconds left.
We are answering W will be 3 to 4 weeks.
Okay.
Then X will be adrenal medulla.
Okay.
Y will be glomerulosa, zona glomerulosa.
Okay. You're exceeding your time.
And Z will be zona reticularis.
Okay, let's have a look at the answers. Okay, so Team E, you have answered only the diagnosis right and the sub-questions are wrong. So you'll get only 10 points for this question. Tejas, yes? Can I know your
They
query?
answered angiomyolipoma. You should have passed it on to the next team.
Adrenal myolipoma.
Yeah, angiolipoma is different from adrenal myolipoma.
And whatever they answered, that is not an adrenal tumor at all. You can check the audio if you want.
Okay. Team E, can you please repeat your answer? It was Team E.
Actually, I said adrenal, but in between, I also used the word angio. It was adrenal myelolipoma, which I was going to say.
You said angiomyolipoma. Come on, bro.
Yes, but
Yeah,
I also
angio
used the word adrenal, but in between I also said angio. Yes, I'm admitting that.
yeah, angio is not correct. No?
Yeah, I admit.
Okay, we'll put this question on hold. We will check this question in our live, which is being streamed on YouTube, and then we'll allot marks for this question.
But
Is that
what
okay with
about
all? Yes.
what about passing it? Because we knew the answer. Team D knew the answer, so this is not correct with us.
If at all this was wrong, we will not give any marks to any team. If it was right, they'll get their marks. We have to check it again. Right now, we can't go back because it's not recorded and it's being streamed live online. So once we check there, we'll be allotting the marks for this. Our team members will be checking it.
Yeah, but we lost
Apologies from our side.
our opportunity to get it passed. No, so that is injustice with us.
Yes, apologies from our side for not being so attentive to the participants' answers. This will not be repeated, and yeah, we'll go back, check this question, and then marks will be allotted. Right? Hope that works for everyone. Right? Can we go back to the next question? Next question to team D.
We'll pick grapes.
Okay. So let's see what's behind the grapes. Team D, your time starts now.
Is this acromegaly due to a pituitary adenoma, most likely? Hello?
Right. Team D, that's the right answer.
Am I
Can you go?
audible?
Yes, you are. Right. That's the right answer, Team D. And your sub question for this question is you get 30 seconds for this. Your time starts now.
बेस्ट स्क्रीनिंग टेस्ट GH करें या IGF-1 लेवल करें? See, screening and confirmatory GH levels and IGF-1 levels. Then the drug X which can be used is Parkinsonism के लिए भी drug use होती है. Bromocriptine for an adenoma which can also be used in Parkinsonism.
Time's up.
So, team, would you like to tell your answer, final answer?
I gave answers.
Yeah. Please repeat them.
GH levels and IGF-1 levels.
For GH and IGF level, we would administer insulin and then observe, to be specific, in the morning.
And then the drug bromocriptine for...
Sorry for interrupting. Mention the right answers only, not the explanation. We just want the answers now. Your time is up. Please.
Serum GH, serum IGF-1, the drug X is bromocriptine, also used for Parkinsonism.
That's the right answer, and you get full points for this question. Right. Here are your answers. Next question to Team C.
An apple a day.
Can we go back to the fruits slide? Yeah, which fruit are you choosing, Team C?
An apple a day.
Okay, apple. And here's your question. Your time starts now.
Thirty seconds left.
Okay, the answer is like congenital adrenal hyperplasia. And like as 17 hydroxyprogesterone levels are normal, so other like enzymes would be involved, like 21 and 11.
10 seconds left.
11 are forward.
Can you be more specific with your answer? Please
Like,
repeat it.
am I supposed to name the
Time's up.
enzyme defect?
Yes.
Okay. So the answer would be 21 hydroxylase deficiency. Congenital adrenal hyperplasia due to 21 hydroxylase deficiency.
That's the right answer. Can we go to the subset of question? The 30 seconds start now.
And enzyme we gave answer like 21 alpha hydroxylase. And the inheritance pattern is autosomal recessive.
Congratulations, team. That's the right answer. And you get full points for this. Okay. Next, moving on to the question for Team B. Team B, which fruit would you like to choose?
Last image.
Last image. Okay. It's jackfruit. And your question is, your time starts now.
Thirty more seconds.
Liraglutide.
That's the right answer. Can you please repeat?
Liraglutide.
Liraglutide. That's the right answer. Can we go to the sub question?
Time starts now.
You have 30 seconds for this question.
Axina
15 seconds
type,
left.
semaglutide, and dulaglutide. Okay. Ages is advanced glycation end products.
Time's up.
PPAR gamma is peroxisomal proliferating activating receptors gamma. Peroxisomal proliferating activating receptors.
That's the right answer, team. You get full points for this question. Yes.
Excuse me.
Yes.
The time was up before he answered, actually.
Right. He was answering. He completed part of the answer and that sub question. Hope that makes sense, right? It was the last part which he was expanding, and it took 5 seconds more. Right, so team B, you get full points for this question. Going on to the next question for team A. Yes, Pratham Shah, can I know your query?
Can you please show the question once again? I guess it was oral drug which was asked in the question.
Which question?
The last question.
Last question. Just a second.
It is mentioned that he is also hesitant to use injectables, and liraglutide is injectable drug, I guess.
Yes, liraglutide is subcutaneous. In GLP analogs, only semaglutide is oral. So I guess the answer is wrong. And all the gliptins are oral. So the answer could have been linagliptin instead.
Yes, linagliptin.
And if the answer is wrong, then all the sub questions are also not going to be count, I guess,
Yes.
if you follow the rule.
Just give me a minute. We'll just discuss. Any other query from your side? Priyanshu.
Yeah.
Yes,
Can
yes.
you please
Priyanshu.
keep the track of the answers? This also creates injustice to teams getting the pass. The teams knowing the answer also do not get the points.
Sure. Pratham Shah, any other query from your side? Your hand is raised.
No, ma'am.
Yeah. Give us a minute. We'll just discuss and get back to you. So team B, there was a mistake from our side. There was a mistake in the question itself. So we will be giving you another question. Team B, you will have another question,
Okay.
right? The question will be displayed here. You will get 1 minute. And the sub questions, I will be reading out the sub questions and you'll have to answer that in 30 seconds. Yes, Tejas.
What was the error in the question from your side?
There was a mistake. All the mistakes that you pointed out is our mistake.
So we should also have gotten another question to pass on once you rejected Team E's question. They answered incorrectly. They don't deserve the marks, and you are offering them a second chance. I don't know the basis of that. The question was correct. You should have paid more attention.
Team E's case is different. They answered it wrong. We did not pay attention to the answer, so they won't get any points. Team E is not getting any point. Team B.
He is referring to Team B. The question was right.
Yes. Yes,
It was
yes.
written oral drug
The
from
question
your
is correct. The answer should have been linagliptin, not liraglutide.
Yes, they answered wrong. So how can they get another,
They
question?
answered wrong. We also gave it wrong. So we are changing the question for Team B.
But why are they getting a new question?
But the question was right. Like the question had an answer. They didn't answer the correct answer, right?
You should just move ahead because the answer was incorrect.
Okay, fine. So if that is the case with all the teams, the question is right. Our answer was also wrong. If it is fine with all the other teams, then Team B gets 0 points for this question.
Yes, what everyone else is saying is correct. I mean, now if they answer the question correctly and they get points for it, then it will be like a scenario of injustice. Right? They should have
The
it earlier.
question was
only.
the question given was correct.
They answered
Yeah.
it wrong, so they don't deserve any marks. They should move ahead.
So Team B gets 0 points here. We'll move to the final question of this round. Yes, Ratnam Shah.
Can you show the question of the Apple Team C's question once again?
Team C.
Huh.
Just a minute.
Hello.
Yes, who was it? Okay, Tejas, you want us to show the question of Team C, right? Tejas, am I audible?
I did not ask for it. It was Ratnam who was.
I'm sorry. Sorry for that. Ratnam Shah, you want to see the question for Team C?
Team C,
right?
Apple.
Can I know the reason?
I have one query regarding that question.
Okay, can we go back to the question after we complete this round? I mean, for the last question, right?
Sure.
Okay. So, Team A?
Yes, we are ready.
You ready? Okay. Question is, your time starts now.
Can we answer? Hello?
Yes.
30 seconds left.
Yeah, the diagnosis is primary hyperparathyroidism due to a parathyroid adenoma, And the cystic lesion in the phalanx is an osteitis fibrosa cystica, or the brown tumor.
That's great. Can we go to the subset of this question? You get 30 seconds for this.
Tejas, sorry, Devayan.
Men 1 है ना?
NF1 रहेगा ना, न्यूरोफाइब्रोमैटोसिस में रहता है, वॉन ड्रेकनिंग हाउसेन डिजीज में।
नहीं, वो नहीं है।
ठीक है।
Main one.
Answer to B is men 1.
And 4 bisphosphonates, alendronate, risedronate, zolendronate, and
Pamidronate.
Great. You get full points for this question. Can you go to the answer slide? Right. With this, we come to the end of this round. So, Ratnam, can I know your query regarding that question?
In that question, it was mentioned that they have excluded the salt wasting, and the lab parameters show the 17-hydroxy progesterone levels are normal. So, which rules out the 21-alpha hydroxylase because it characteristically presents with the salt wasting, and also it is 17-hydroxy progesterone is the screening test for that enzyme's deficiency.
Can you please repeat the last 2 lines?
In that question, they have excluded the salt wasting, and the 17-hydroxy progesterone levels are shown to be normal. In the classical 21-alpha hydroxylase deficiency, the 17-hydroxy progesterone levels are elevated, which is used as screening test, and the salt wasting is classically present in this scenario.
Okay, so you're speaking about the classical question, classical case scenario, but we did not mention that term in our question.
But ma'am, in any case scenario, the biochemistry levels are not atypical. It is mentioned that 17-hydroxy progesterone levels were normal.
I'm sorry to interrupt, but I think the quiz should go on. ऐसे time waste हो रहा है. अगर ऐसा कुछ problem था, तो question के बाद तुम object करना चाहिए था, not like after the next question was done. So, the time is getting wasted here, and
it's not about time waste. The wrong thing should be corrected. Like
Yes,
everyone is also
You
getting.
could show us the
I
question
think we
once.
should get the chance.
Yeah, you should have posted the question once the question was done. You can't. It's unfair. Like you are stopping the quiz in the middle.
What is unfair regarding this?
You can show us the question once.
Participants, sorry for the interruption. If you have any queries, directly ask us, and there should be no argument among yourselves. And due to time constraint, and your objection should be right after the question, no repeatedly going back to the question, right? So we are not going back according to what we have checked with our team.
But the ma'am answer was wrong.
Right. Which answer was wrong?
The 21-alpha hydroxylase, because the 17-hydroxy progesterone levels were normal.
Actually, see, whatever your queries are, we have noted down everything. For this round, we are not displaying the scores. Right after the next round, we will be displaying the scores after solving all your queries. Right? Hope we can go forward. Right. And we don't encourage opposing every question after each round. If you have any queries, we want it to be objected right after the question is displayed or after the answer is told by the other participants. Hope I'm clear with this point. Right? Whatever your queries are, we have noted down everything. it will be clarified. For now, let's move on to the next round. And teams, this is strictly from the organizing team. There should be no argument among yourselves. Whatever your queries are, please put forward to us. Let's move on to our third round for this evening. Okay. Let's move on to the third round, the Cascade round. Can we go to the next round, please?
Loading.
Yeah, this is going to be one of the interesting rounds. So let me explain the rules before it starts. There will be a spin wheel. Okay. I'll randomly call out the team names, and each person from the team, you can just choose. No, you say start and stop. It's completely random and no bias from the organizing team. The spin wheel will stop at a particular organ, and you'll have a set of questions related to that organ. Right? And there is no passing for this round. If you answer all the questions right, you'll be awarded the total score. Hope this is clear. Right? So, round 3, Cascade round. Yeah. So, your spin wheel will have 6 glands in it, 6 organs. It's not according to how it is mentioned on the slide. It's not with the team with least score. I will be randomly calling out the team names who will come in this order, and accordingly your glands will be allotted. And then a set of 6 questions related to that particular gland which is being allotted for your team will be asked. Once all the team complete spinning the wheel, then we'll proceed to the questions. Can you go to the next slide? Right. So you'll have 2 minutes, total time of 2 minutes for the whole 6 questions. If you correct, for the first question, if a team answers question 1 correctly, you'll get 10 points. If you answer question 2 right, you'll get plus 10. That is, you get 20 points. If you answer 3 correct, you get 30 points. So for the total 1, 2 and 3 questions, you'll get 10 plus 20 plus 30. That is total of 60 points. If at all, if you answer first question right, second one wrong, and third question right, you'll get only 10 plus 10, 20 points. Is that clear? We have a sample question, and you can have a look at the sample question. Any of you can, you can see how the marking scheme goes. So first question answered right, you'll get 10 points. Second, you'll get 20 points. If the third one was right, it will be like plus 30. But because third one is wrong, you get 0. And for the fourth question, again it is plus 10. Fifth plus 20. And sixth it is plus 30. This is how the marking scheme of this round will be. Is it clear for everyone? If that's clear, can you all please give me a thumbs up? Yes, Hit? Can I know your query? Right.
It was raised by mistake.
All right. Any questions, any doubts? Okay. Hope we can go to the next slide. So first it would be team E. Team E, and your gland will be.
Yes.
You can say start.
Start. Stop.
Team E
Adrenal આવ્યો ને?
is adrenal gland.
Adrenal માં કઈ શું આવી શકે બીજું?
Okay. Team B.
Start.
Yes.
चल चालू रख अच्छा
Stop.
Team B, your gland is pancreas.
Okay.
Team F.
Start. Stop.
Team F, you get questions on the gonads. Team A.
Start. Stop.
Team A, your gland is parathyroid. Team D. Team D, your questions are going to be on thyroid gland. Right? And Team C, your gland is...
Stop.
Yeah, that's pituitary gland. Okay?
Sir, doubt, sir.
We'll go with Team E first. Team E, yours is adrenal gland. You get a total of 2 minutes for these questions. And one person should tell me all the answers in a sequence. If you're giving the answers in jumbled way, we are not going to accept it. Only the sequence will be taken. Okay? Team E, are you ready?
Yes.
Yes. And your questions are? Can you have the questions on the screen? So teams, for your information, you'll have total 2 minutes. As you answer every question, we'll move to the next question. Okay? Do you have any doubts?
No.
If you answer the first question, then we'll move to the second question.
Okay.
Right? Can you have the question on the screen? The time starts now.
Fludrocortisone. Next question. Name the combination used in the airbags. Pheochromocytoma.
Vincristine, carboplatin, and
Dacarbazine. Next.
Is that your final answer?
Yes. Continue.
Yes.
Protein and running with the features hypercortisol, advertisers, and high ratios, lateral cortex. Hypercortisol. શું કહેવાનું આમાં તો યાર?
what staging systems is what I
આવડે? Khabar? Can you skip the question?
Yes. Can we go to the next question?
Which is the following history of very good. Khabars? SDHD.
Next question.
Yeah. Very nice. Present the company of the first headache palpitation. Understand synthesis. पड़ेगा कौन syndrome also?
10 seconds left.
Cone syndrome. Primary hyperaldosteronism.
Next question.
Sorry, time's up.
Yes.
यार आना तो बच्चे कितना time खा दो.
So, team, you have answered a total of 5 questions, out of which 2 are right. So, the first 2 questions are right. So, you get 10 plus 20, total of 30 points for this.
Excuse me.
Yes.
Second question was wrong. Instead of cyclophosphamide, they said carboplatin.
Yes.
Yes.
Weaver Bush's cyclophosphamide, vincristine, dacarbazine.
The first and the fifth question was right, so it should be technically plus 20. Or the 20 points.
Okay, so the second answer was also wrong. The fifth answer was also wrong. Fifth one was not right. So they get only 10 points for this.
Ma'am, there shouldn't be partial marking as half of it was right. The pheochromocytoma thing was right. The drugs combination was...
The drugs were asked, not the...
Yeah, that is not pheochromocytoma. We want the complete answer, right?
But ma'am, we would treat the pheochromocytoma only if it is metastasized. Why would we give the chemotherapy then?
We have asked the question completely. Please go through the question again. The answer is wrong. Only the first answer is right, and you get 10 points for this question. I believe there should be no more arguments. Team E, you scored a total of 10 points for this question. Let's move on to question for Team A. Team A, your gland is parathyroid.
Yes, we are ready.
Right. And your time starts now.
A is inferior parathyroid gland and B is in the lumbosacral region.
Next question.
Ragard is fine.
Next question.
Cinacalcet.
Next question.
Denosumab.
Protogerin.
Next question.
First option.
Next question.
$45 seconds left.
Parathyroid jaw tumor syndrome, parafibromin gene mutation.
Can we have the answer, please?
Parathyroid jaw tumor syndrome.
Right. That's a great try, team. So, out of the 6 questions, the first one was wrong. Question number 2, 3, 4 were answered right. Question number 5 is wrong, and 6 was answered right. So, you get 10 plus 20 plus 30 plus 10.
They answered denosumab instead of osteoprotection. Please check.
Yes.
4, 6 only right.
Okay. Can you please go back to the questions? So your first answer is wrong. Second one is correct. Third one is also correct. Your fourth answer was yeah, they told protegerin, but it was not osteoprotegerin. But the
I told
let,
denosumab earlier. You can consider it as incorrect if you want.
let me tell. I've mentioned in the beginning rules, the first one will be taken right. So you answered first. That was wrong. So fourth answer is wrong. Your fifth answer was wrong. The sixth answer is right. So you get 10 plus 20 plus 10, a total of 40 points for this question. Right? Good one, team A. Let's go to team D. Team D, your organ is thyroid gland.
Yes.
Can we have the for team D? And your time starts now.
Inferior thyroid artery is ligated and it is the recurrent laryngeal nerve. Next. Lugol's iodine.
Next.
Do oxygen. क्या बोलना है?
Thyroid peroxidase.
Next.
Thyroglobulin is low. This is factitious thyrotoxicosis.
Next. This is an MCQ
60 seconds
question.
left.
Yeah, 60 seconds left, and this is an MCQ question.
Option 1, option A. Next time.
Next question.
Dominant cystic female. Dominant में कम होगा cystic female. A 3%.
Okay. So, team D. Can we go back to the questions?
You are not audible. Hello.
Yeah. So, team D, you answered question 3 correct, 4 correct, and 6. You get 10 plus 20 plus 10. Total of 40 points for this set.
Okay.
Good one, team. Can we go to team B now? Team B, your organ is pancreas. Team B, right. So your time starts now.
Insulinoma.
Next question.
Pioglitazones.
Next question.
C.
Next question.
Glargine.
Next question.
$140.
Next question.
Thirty more seconds.
A. Theophylline.
And the answer is C. So, Team B, you have answered question. Can we go back to question 1? You answered question 1 right. Question 1 right. Then 2 wrong, 3 wrong. Question number 4 and 5 are right. Question 6 is wrong. So you get 10 plus 10 plus 20, total of 40 points for this round. Team B, we have asked the histological finding also for the first question, but you mentioned only insulinoma, so we are not giving points for this question as well. So you get only points only for question number 4 and 5. Right? So it is 10 plus 20, total of 30 points. Next is Team F. F, your organ is gonads. Team F, are you ready here? Team F, your time starts now.
HCG, HPL, and progesterone.
Next question.
Danazole.
Next question.
$45 seconds left.
HCG 14 days.
Next question.
$25 seconds left.
My camera, my voice was on mute. I was not able to I'm realizing that now. I was saying the
We are not
answers.
responsible for that. We are not responsible for that. Your
5
time is up.
seconds left.
I'm skip
this
Next
question.
Time's up.
Your time is up. Yeah, so Team F, just a minute. Team F, give us a minute. We'll just let you know your score here. So Team F, you have answered only one question right. That is question number 2. So you get 10 points here. Right? So next we'll go to Team A. Team A and your organ
A is over.
I'm sorry.
Team A is over.
Over. It is Team C. I'm sorry. Team C,
Yeah,
your
yeah,
organ is
yeah,
gland. Right. Your time starts now.
You need not answer yet.
No. Pass.
Next question.
Nafarelin, busurelin. Anterior pituitary is from Rathke's pouch. Posterior pituitary is from neurohypophysis. Stalk is from tuber cynarum, like elongation of neurohypophysis as well. And intermediate can part hoy છે.
Next.
One minute
Kalman
left.
syndrome. ના માઇક્રોસ્કોપિક ફીચર પૂછ્યું છે પિટ્યુટરી આઈડીના મોસ્ટ ઇઝ પ્રોલેક્ટિનોમા એસિડોફિલિક સેલ્સ
25 seconds left.
આ પેલું છે ને મેકાર શેરિલ કયું હતું એમથી હતું ને મેકાર ડ્રગનું નામ યાદ છે મેકાસર્મિન મિસાઇલેટ મેકાસર્મિન
5 seconds.
મેકાસર્મિન મિસાઇલેટ
That was a good try, team. Your time is up. So Team C, you have answered question number 6 correct. And just a minute. Yeah, you have answered question number 2, 4, and 6 right. So you get a total of 10 plus 10 plus 10, 30 points for this set. Congratulations.
They
And
did not
yes,
answer question 2 completely. You did not allow them to.
can we go back to question number 2? No, we gave them time. They told all the 4 options. Only after they said, I did say next.
I thought question number 2 was the pituitary question.
Question
Can you
number
show
2.
the question 3 please?
That was question 3 actually.
What was question 4?
Tejas, you're from team D, right? Yeah.
Yes.
You want to see question 4? Yeah.
Can you
you
show
have
the
the
answers? Can you show the answers for question 3? Team C here.
Yeah. Team C, what is your query, please? Team C, can you please repeat what was your point?
Yeah, we didn't answer it. We are good with the marks.
Right.
Can you show us question 4 once?
Can you have question number 4 on screen, please? Yes.
Okay. Yes, it's fine.
Right? Fine. So with this, we come to end of round 3. So participants, please give us a minute. Before that, we have audience question for this round. Now, this is for those audience who are watching us live on YouTube. Here is your question. Right. Participants, you can take a break for 2 to 3 minutes, have a sip of water. Please be back by 7:25. Once this audience question is done, we will proceed with the next round. Yes, please. Can I know your query, Pratham Shah?
I was suggesting that can we cut short this 8 round thing into something which is feasible for all, as I guess it would take too long for this quiz to end, I guess, if it will be a
Uh,
complete 8 round quiz then.
So, Pratham Shah, this is something designed by us, and we have been working on this for months together. We are not going to change the rounds or rules for any participant.
No, I
Hope
was
I'm.
just saying if
Yeah.
you could reduce the
But
number of questions per round.
No, we are not going to.
I would request you to please be a little quick because there are 8 rounds and it's already 7:30. So it's better you can just finish it up quickly.
Sure.
Yeah.
Will upcoming rounds are shorter. We have short questions in the upcoming rounds, and it won't take this much time. I'm sure will not waste your time. So yeah, it's a break for 2 minutes, and then please come back by 7:25. We'll resume. Till then, audience, you have 2 more minutes to answer this question. Right. So, welcome back all. We have the answer for the audience question. Okay. So username Tricks Universe was the fastest and the right one to give us the right answer for the audience question. So guys,
இன்னும் few more answer பண்ணிருந்தாங்க.
along with Tricks University, we have Ankit, Sumaya, Aisha, and Kirtana. We have given right answers for the audience question. Thank you so much for participating. So participants, your scoreboard is being prepared. Speaking about round 2, Team A, you scored 20 points. Team B, your answer is wrong. Team C, your answer is wrong. Team D, you get 20 points. Team E, your answer is wrong. And Team F, you get 20 points. This is for the case scenario round.
Excuse me, like, can I ask why the our answer was discarded?
So, your answer is wrong. The question was right, but your answer is wrong.
Like, we answered it correctly. We said congenital adrenal hyperplasia. That was the diagnosis.
Yeah, but we wanted it to be specific. It is not just 21 hydroxylase, which is enzyme we mentioned.
But that
Wanted.
was the sub question. That was enzyme was the sub question.
Let me complete my answer, please. The complete answer is simple virilizing form of congenital, right? So, I think your answer was not complete, and a team has finalized that that was the right answer we wanted. We wanted a complete answer.
But then you should have asked. No, like, I would have answered. I knew that it was going in that direction.
Within the time limit, we did not get the complete answer. You don't get
Seriously.
that question. And Team C, if you could recollect, in the last line of the question, we mentioned to be specific about the type of the disease, right? The word specific, we asked you to be specific in the question itself. Okay, so you don't get any points for that question. Fine. Can we have the scorecard, please? Yeah, at the end of 2 rounds, these are your scores. Team A standing on top with total of 40 points. Team B, 20 points. Team C, 20. Team D, 20 points. Team E, 25 points. And Team F with 35 points. Your scores of round 3 and 4 will be displayed together at the end of round 4. Right? With this, my section is done. I would like to give it over to my co-host, Naveen. He will be taking over for the next 3 rounds. Great going, guys, and all the best. Over to you, Naveen.
Thank you, Jyotika. So, myself Naveen from Government Mohan Kumar Mangalam Medical College, Salem, and I will be the host for the upcoming 3 rounds, round 4, 5, and 6. So, are you guys ready for the round 4? Just give me a thumbs up if you are ready. Okay. Let's move on to the round 4, which is video vacanza. So, the rules of this round are as follows. So this round consists of 6 questions, one question for each team, and each question has one video. You should find the diagnosis or sign being depicted in the video. Then you will get one question related to the video. The sub question will be revealed only after answering the main question. And this round has pass question, which will be allowed to the next 2 teams. Then the time limit for this round is 45 seconds. Video will be played 2 times at the beginning itself. So video cannot be replayed after that. So kindly check your internet connection so that the video is visible for you guys. And the time starts once the video ends. And you will be awarded with plus 10 marks for diagnosing the video and plus 5 marks for the sub question. And in case of pass question, half of the marks will be awarded. And the quizmaster's decision is final. Okay. You guys have any doubts? Yes, Priyanshu?
How will be the passing decided? To next team or anyone who raises
Yeah,
the
passing will be to the next team in order. A to, yeah.
Oh, 2 teams would be passed. Yani. 2 times it
Yeah.
would be passed.
Yeah, pass is allowed maximum up to 2 teams. Shall we move on to the question? Just give me a thumbs up so that I will start with the round. Okay. Hope you all are ready. So first let's start with team A. Kindly choose one word. Team A.
Bol bhai.
Yeah, can you please repeat it?
Peacock.
Peacock. Okay, team A has chosen peacock. So your question is,
बता दूं क्या आता है मेरे को हेलो
हाँ सर बता दीजिए.
This is the
okay, your
Pizillo's
time starts now.
It is the Pizillo's method for examination of the thyroid gland.
Okay. Can you please explain the procedure?
So basically, to make the thyroid gland more prominent, the person is asked
Yeah,
to.
I'm just asking the procedure. Yeah, you can continue.
Yeah, so it is basically to make the thyroid gland more prominent. So the person is asked to push his occiput against his joined hands. So
Yeah,
that is called the Pizillo's
I'll give it to you. So the sub question is, what's the use of this method?
It is basically to make the thyroid gland more prominent, which aids in the proper examination of the thyroid structure.
Okay, can you be more specific a bit?
It makes the gland more prominent, so palpating the gland becomes easier.
Okay, so the time's up. Actually, so the answer is Pizillo's method, and the use is to make the thyroid gland more prominent in case of obese and short neck individuals. Okay,
I
I'll give
have
it to you.
told that, no?
Yeah, I'll give it to you. So team A has scored 10 plus 5, total 15 marks. 15 marks. Okay. Next, team B, are you ready?
Flamingo.
Yeah, team B has chosen flamingo. So here's the question for team B. Okay, your time starts now.
This is the Lahey's method.
Okay, can you please explain it?
It is used for check the nodularity of the gland. It should check any nodulars.
Sorry, can you please repeat it?
This we push the gland through one side
Okay.
and check nodularity in the prominent location so that we can easily
Okay,
locate the
okay,
nodules.
okay. You're right. You're right. So your sub question: what is aberrant thyroid?
It is the lymph node lateral for the papillary thyroid
Yeah.
cancer.
Yeah, you're correct. Okay, so team B has scored full points, 15 marks. So the method was Ragi's method, and aberrant thyroid, as Yash Ratwani has mentioned, it's metastatic enlargement of neck lymph nodes, which appears to be thyroid gland enlargement. Well done, guys. Now let's move on to team C. Team C, kindly choose one number. Team C, are you there?
Yeah.
Yeah.
Dove.
Dove. Okay. Team C has chosen Dove. So the question for Team C is,
This is Pemberton sign for retrosternal.
wait. Time has not yet started. Once I say start, then you should answer. Okay, start.
This is Pemberton sign, which is used for examination of retrosternal goiter. When we ask to raise the hands due to obstruction, there is
Okay.
congestion of the face.
You're right. So what's the sub question? I hope you have answered the sub question too. The positivity of this sign indicates what?
Retrosternal extension of
Yeah,
goiter.
you're right. So Team C has bagged total 15 points for this round. Congratulations, Team C. Now let's move on to Team D. Team D, are you ready? Kindly choose one of the birds.
The sparrow, house sparrow.
Sparrow. Okay, Team D has chosen Sparrow. Let's see what they get. So this is for Team D. Kindly start answering once I say start.
मैं बोलता हूँ ये
Wait. Yeah, your time starts now.
This is Cocker's maneuver. We are
What?
pressing Cocker's maneuver.
Cocker's maneuver. Are you sure with the answer?
Yes, we are pressing it from either side to check if the trachea is narrowing or if there is any malignant extension.
Oh, you are saying coach's test. You are saying coach's test,
There
right?
would be strider. Please show the question.
Yeah, sorry. It's not the correct answer. Yeah, this is the question. See, what sign can we elicit it by
So
doing the
we press
procedures?
it from either side to see if there is tracheomalacia or if there is malignant
Sorry,
extension.
your
Then the
answer is
strider
wrong.
will be produced.
Sorry, your answer is wrong. It was not the answer we were expecting. Now I am passing this question to Team E. Team E, any answer from your side?
Yes, it is Barry's sign.
Yeah, you're right. It's Barry's sign. So Team E is getting 5 marks for diagnosis. So what's the sub question? What's the reason for this sign? Yes, can you please
Carotid
answer it?
artery pulsation.
Yeah, no. What's the reason for this sign? Sorry, your answer is wrong. I can't give it for it. Can't give for that answer. So the reason was infiltration of the carotid sheath by the enlarging thyroid. So I was expecting this answer. So for this question, Team E has scored 5 points. Team D hasn't scored points. Next, now it's that question for Team E. Team E, can you choose one bird?
Yes, we are choosing the macaw.
Okay, you're going with macaw. So this is the question for Team E.
Cryly. તો એમને જ બોલવા દો ને. હું બોલી દઉં છું ચાલશે.
The time starts now.
Yes, it is the Criley's method.
Okay, can you please explain the procedure?
Yes, so we are placing the thumb on the while the patient is swallowing, so we can
Yes.
diagnose if there are any
Okay,
hidden.
you're right. So I'm opening a sub question. What's the importance of this method?
A small thyroid nodule can be palpated if
Yeah,
present.
you're right. You're right. Congratulations. You have back with a total 15 points for your question. So it was Kreitz method, and importance is to detect any slight enlargement of the gland or presence of any nodules. Okay. Now let's move on to team F. You're left with only Swan. So team F, are you ready? Team F, kindly switch on your mic.
Yeah.
Are you ready?
Yeah.
Okay. So this is the question for team F. Okay, the time starts now. Should be answering the sign and the disorder in which it is observed. Yes, team F, any guesses? Time is ticking. Team F, any guesses? We're left with 10 more seconds. Team F. I hope no answers from Team F, so I'm passing this question to Team A. Team A, do you have any answer? Please be quick. Team A?
Meniere's disease.
What? Can you please repeat?
Meniere's disease.
No, sorry, it's wrong. Team B? Team B? Are you there? Okay, I'm passing to Team C.
Cataplexy, narcolepsy.
Yeah, you're right. It's cataplexy and it is seen in narcolepsy. Your Team C, right?
But only
Yeah.
two passes are allowed, right? Only two passes were allowed, and already the first pass.
Oh, sorry. Okay, sorry. So as we mentioned, it is cataplexy seen in narcolepsy. But anyhow, congratulations, Team C. But I'm not going to give any points. So, which hormone deficiency leads to this condition? Anyone can attempt, but no marks.
Hypocretin.
Yeah, you're right. Hypocretin. So that's it. We end this round with this question. Now it's time for the audience question. Audience, are you ready? Okay. This is for the audience. Kindly watch to the video. By the time team participants can also attempt, but no marks will be provided. Okay, audience, your time starts now. Identify the method which is being demonstrated in the video. Okay. Audience has not answered for this question. So let me reveal the answer for this question. So participants, anyone want to try for this question? Yes, first was raised by Nishit Thakkar, but I won't give marks.
Yeah, it's Nafziger method for proptosis.
Yeah, you're right. It's Nafziger method for acceptance. Great, great. Okay. I hope you had fun with this video round. Now let's move on to the next round, round number 5. Give me a minute. I'm just opening the presentation.
Sorry for the interruption. Medansh, did you text any of our organizers for any query?
Actually, I'm having some problems with connectivity. Can you give me 2 minutes? My camera is not able to open in the laptop. Just 2 minutes. I'll try to switch devices.
Okay, please put this device on. Don't leave the meeting in this device.
Yeah, this is
Meanwhile, you can do it on the other device as well.
okay.
Right.
Riddle, can you just proceed with the round? Like already so much time has passed.
Yes, please continue.
Yeah. Let's continue with the round 5. So this is a new round called Japar. So I'll move on to the rules of this round. So each team will get one set of questions and you should answer it in 45 seconds. Okay. So there will be 2 statements. The first statement has one blank. So you will be having two statements. The first statement has one blank A and the second statement has 2 blanks A and B. So the team should find A and then substitute the answer of A in the second statement and you should find B. So finally, I should be getting the answer in a statement form. You should be reading the statement of B by filling both the fill-ups. Okay. We have a sample question, so don't worry. So each set carries 20 marks. Marks will be given only if both A and B are correct and second statement is told completely. So the question will be passed if the answer is wrong or if the time is up, and question will be passed only if it is completely unanswered. If it is partially unanswered, I won't be passing it and only 2 passes are allowed. So I'll be showing a sample question. So you'll be getting 2 statements like this, statement A and statement B. First, you should find the answer of statement A and you should fill the answer of statement A in statement B to find the answer B. Then finally, you should be giving me the answer of statement B. So the answer for this question is, for A, it's carcinoid syndrome and for B, it's upper intestinal endoscopy. So your answer should be like, upper intestinal endoscopy is considered the gold standard statement with biopsy of identified lesion in carcinoid syndrome. So are you guys clear with this round? Do you have any doubts? Or am I too fast? Kindly react with thumbs up so that I can know. Okay, I hope all are clear with this round. Let's start this round in a reverse order from team F to team A. So team F, are you there? Can you please choose one image?
Volcano.
Volcano. Okay, team F has chosen volcano. So you'll be getting 45 seconds and you should be giving me only the statement. Okay, are you ready? Okay. Team F, here's your question. Your time starts now. Oh, sorry. Yeah, your time starts now. Note, you should be giving the answer in a statement. Each statement should be given as answer by filling up the A and B. Team F, time is running. Any guesses, Team F?
Hello?
Yeah.
Yeah, so calcitonin and carcinoembryonic antigen A are the tumor markers of medullary thyroid carcinoma. and medullary thyroid carcinoma metastasis with the lymphatics as well as bloodstream.
Well done. You have bagged the 20 points. You're right. So the answer is calcitonin and carcinoembryonic antigen are the tumor markers of medullary carcinoma of thyroid. So it's the answer. Now let's move on to team E. Team E, are you ready?
Yes.
Yeah, kindly choose one image.
We are going with the matchstick.
Matchstick. Okay. So here's the question for team E. And your time starts now. Yes, team E.
Yes, pineal gland is called the third eye, and the principal secretory product of pineal gland is melatonin.
Super. You have answered it correctly. I'm giving you 20 points. So the principal secretory product of pineal gland is melatonin. Congratulations, team E. Now let's move on to team D. Team D, are you ready? Kindly choose one image.
Fire striking the tree, the fourth image.
Ah, okay. This image. Second row, first one.
Yes.
Am I right? Okay.
Yes, yes.
So the question for team D is as follows. Time starts now. It's team D. Any answers? Kindly give me in a statement form.
Vasopressin and oxytocin hormones are stored in herring bodies.
Can you please repeat it?
Vasopressin and herring bodies, oxytocin hormones are stored in herring bodies.
Yeah, you're right. Correct. I'm giving you 20 points. So oxytocin and vasopressin, or otherwise called antidiuretic hormone, are stored in herring bodies. Okay. Now let's move on to team C. Team C, kindly choose one image.
Campfire.
Campfire. Okay, let's go with campfire. So team C. Here's your question. Time starts now. Sorry. Yeah, time starts now.
The vasopressin is produced by supraoptic nucleus.
Yeah, well done. You have answered both the Phillips correctly. So the vasopressin or ADH is produced by supraoptic nucleus. Congratulations, team C. Now let's move on to team B. Team B, are you there? Kindly choose one image.
The first image.
This one, Olympic touch. This one, right? First row, the last image.
Yes, yes.
Okay. So here's the question for team B. Time starts now.
A is Addisonian crisis.
Can you please give me in a sentence form?
Hello.
Give me in
Am I
sentence
audible?
form. Yeah, you're audible. Kindly say in sentence form.
The most common way to diagnose ACTH, most diagnosed Addisonian crisis ACTH levels.
Addisonian crisis is ACTH level. So your answer is partially correct. Actually the answer was adrenal hemorrhage and CT scanning. So both of the compartments are wrong, so I can't give you any marks. Okay, let's move on to team A. So team A is left with only the atom bomb image. Are you guys ready? Team A?
Yes, we are ready. Hello. Hello.
Okay,
Now
let's.
we are ready.
Okay. Team A, here's your question. Time starts now.
डिवाइन प्लेसेंटा है क्या? कॉर्पस ल्यूटियम ये करते हैं.
हाँ. Transfer of yellow colored body from ovary to placenta. Dash part of A. तो वो है ना syncytial trophoblast और वो वाला नहीं.
हाँ वो भी हो सकता है.
Team A.
ये तो placenta है.
हाँ
Team
ठीक
A
है.
have left with 5 seconds.
आंसर कर दे.
So A is placenta and the
Kindly give me in sentence form.
The trophoblastic part of placenta serves as principal site of protein and steroid hormones.
Can you please repeat it once?
The trophoblastic part of placenta serves as the principal site of protein and steroid hormones in pregnancy. Hello?
Actually,
Yes.
you just told trophoblast. You should be more specific. Syncytial trophoblast.
But
you can give syncytial trophoblast.
Excuse me,
No,
Team
no.
C.
The final.
Hello. You can give them. They were discussing about syncytial trophoblast.
Yes.
So you should give them marks.
But the final answer given was only trophoblast.
But you can consider that much, na?
Trophoblast includes both cyto and syncytio. So cytotrophoblast.
अरे तो we did not take cytotrophoblast का नाम भी नहीं लिया हमने तो मतलब वो तो understood है.
Discussion doesn't matter, right? What matters is the final answer.
Okay. Let me discuss with my organizing team and get you back. Since other teams has mentioned the specific answers, I'll be giving only marks for placenta. So Team A has scored 10 points for this round. Okay.
Excuse me.
Yes.
You had mentioned that correct for marks would only be given if the final statement is correct.
Okay.
In the instructions.
Okay. Give me a minute.
You can show us the instructions. There was no provision for part marking.
Okay. There is no part marking for this round. So sorry, Team A, I can't give you full marks. You haven't scored any marks for this round. So audience, are you guys ready for the audience question? Okay. So here's the audience question. Satwa, you have answered it correctly. So participants, do you want to guess any answers for this question? Okay, I hope no one is interested. Okay, someone has raised their hand. Nishit Thakkar, yes.
L-prostadase is a prostadine analog used for direct injection for ED.
Yeah, you're right. It was alprostadil used for erectile dysfunction. Okay, now let's move on to round 6. Just give me some minutes so that Give me some time so that I will open the presentation. Okay, are you ready for the sixth round? So the sixth round is another connections, but this connection will be of a fun-filled one. So I hope you will all will enjoy this round. So this round consists of 6 questions, one question for each team. Each question has 4 to 6 images. You should connect the terms of all images. You should be connecting the terms to arrive at a disease or a disorder or a drug or an anatomical structure. So the clue will be provided if you demand for it, and pass is allowed to the next 2 teams alone. Then time limit is only 45 seconds. You will be awarded with plus 10 marks for diagnosing without the clue, plus 5 after opening the clue, and half of the marks will be awarded for the fast question. So there will be no negative markings in this round, and the quiz master is deciding the final score. So I have a sample question for you guys. So you can just attempt, but I won't be giving any marks.
I'm sorry, can you
Am I
please show the
audible?
first slide,
Am I audible, everyone?
slide of instructions?
Okay. I'll just repeat it. So this round has 6 questions, 1 question for each team. There will be set of 4 to 6 images. You should be connecting the terms of the images to arrive at a disease or a disorder or a drug or anatomical structure, and clue will be provided if you demand for it. And pass is allowed only to next 2 teams. And time limit is 45 seconds, plus 10 if you diagnose without the clue, and plus 5 for opening the clue. And half of the marks for the past questions, and there will be no negative marks. Shall we open the sample question? Are you all clear with the rules? So anyone can attempt the question, but I won't be giving any marks. Yes. Any guesses? Yeah. Hey, what's your answer?
It's Kalman syndrome.
Yeah, you're right. Kalman syndrome. So this is Kal and this is Man. So you should be connecting in this way. So Kalman syndrome. And if you opt for a clue, I will be opening it for you. So Kalman syndrome. Okay, now let's move from team A to team F. Team A, are you ready?
Yes.
Yeah, team A, kindly choose one fruit.
Divine grape.
Grapes. Okay, let me open grapes for you. So are you guys ready?
Yes.
Yeah. Here's a question and time starts now.
Clue ले लूं क्या?
Team A, do you need any clue?
Clue.
Clue.
Yeah, team A has opted for clue. I'm opening the clue. So it's the hormone. Team A, kindly
Welcome
give your
hormone
answer.
relaxin है क्या?
Team A, 2 more seconds left.
Start in now.
May I get your answer? Sorry, it's time up. I'm passing it to team B.
Vasopressin.
Sorry, it's wrong. The last pass is to team C.
Somatostatin.
Yeah, you're right. It's somatostatin. It's nothing but it's sowing. Okay, sowing the seed. So this is mat, this is O, start, and in. So I'll be giving 2.5 marks for team C for the past question. Okay. Shall we move on to the next question? Next question is to team B. Team B, are you ready? Kindly choose
Yes,
one fruit.
watermelon.
Watermelon. Okay. Team B is going with watermelon. So here's a question and time starts now. Team B, you can feel free to ask the clue. Team B, any answers?
Clue.
Clue. Oh, Team B has opted for clue. It's a part of a gland. So the note the clue. It's a part of a. Yeah, you're correct. Team B has answered with clue, so I'm giving them 5 marks. So the first image is neuron. So neuro, the boy is saying hat. So neuro, height, 4, 5, Raksha Bandhan. This is sister. So neuro, hypo, 5. Well done, Team B. Team B has scored 5 points for this question.
Mango. Hello, am I audible?
Sorry, can you please repeat it?
Mango.
Okay, mango. Team C has opted for mango. So this is the question for team. Your time starts now.
Kocher. Kocher. The answer is Kocher.
Yeah, you're right. It's Kocher's vein. Yes. So the clue was it's a venous drainage of a gland. So it was Kocher's vein. Coach and 2R is human. So Team C has scored 10 points for this question. So now let's go on to Team D. Team D, kindly choose one
The
fruit.
pineapple.
Okay, Team D is going with pineapple. So here's the question for Team D, and your time starts now.
This is diabetic ketoacidosis.
Yeah, wonderful. You have answered the correct correct answer. So it's diabetic ketoacidosis. Diabetic ketoacidosis. Okay. So I'm giving 10 points for this question to Team D. Team D gets 10 points for this question. Okay. Now let's move on to Team E. Team E, are you ready? Kindly choose one image.
We are going with apple.
Apple. Okay. Team E is going with apple. So an apple a day keeps the doctor away. Okay. So this is the question for Team E. And your time starts now.
ફોલન કુલર છે પછી ગાડી છે કાર સી તો કાર્સિનોમા છે છેલ્લે.
Team E, do you want me to open the clue?
No, we are not going for the clue.
Okay. So 10 more seconds left. Be quick. Team E. I hope
Yes.
it's an easy question.
Yes, you can go for the clue.
Okay. I'm opening the clue for Team E. So it's a clue.
Okay.
It's a kind of cancer condition. Okay. Sorry. Time's up for Team E. I'm passing this question to Team F. Team F, any answers from your side? Team F, kindly respond.
No.
Okay. Okay. Team A, any guesses? It's an easy one. Team A. Team A. Okay. Team A has no answers. So no one has answered this question. Any other teams? Any other teams can attempt this question. Audience, you can also attempt the question. You can put your answers in the chat box. It's an easy one.
Carcinoma.
Yeah, you're right, Dhruv. It's follicular carcinoma. The first is fall, autumn season, or otherwise called fall. E, this is an air cooler. So follicular carcinoma. I hope Team E has found the second part, carcinoma, but they have missed the first part. Okay, no worries. So the answer is follicular carcinoma. So I hope all teams have attempted this round. So now let's move on to the audience question. Sorry,
We are left.
am I left any one team?
Yeah, Team F.
Sorry. Okay, sorry. So team F, can you please choose one image? Sorry,
Riddle.
you're left with only jackfruit. Sorry. Okay. So here's the question for team F. Your time starts now. I hope team F gets it right. Yes, come on, team F. Any guesses? Or do you want me to open the clue?
Clue will be better.
Yes, team F.
Clue.
Clue. Okay, team F has opted for clue. It's the drug. So 5 more seconds left. Be quick. Team F. 3, 2, 1. And it's time up for team F. I'm passing this question to team A.
Hard to say.
Who is answering this?
Team F.
Team F, sorry, it's time up. I can't give mark for this. I have passed this question to team A, and team F has answered it. So I can't give this mark to any of the teams. Sorry, guys.
Had to say. I just
Yeah,
like it was
was.
Yeah, it's just
Yeah.
2 seconds.
No. I have said the time's up, and I have passed the question to team A. If you have answered before, I have said pass the question to team A. I would have considered, but I have passed it. Sorry, I can't give a mark for this. So anyhow, it was atosipan. So ha, to, si, and ban. Okay. I hope everyone have attempted this round. Shall we move on to the audience question? Audience, are you ready? So here's the audience question. Come on, guys. It's a condition related to thyroid. I hope it's a too easy question. Audience side, any answers? Okay, we have the results of the audience question. So congratulations, guys. Ankit, Satwa, Sumaya, Geeta, Ananya has answered the question correctly. So participants, do we need to attempt this question? Any answers from your side? Anyone willing to answer this question? I have.
It will be Hashimoto's thyroid.
Yeah, you're correct. It's Hashimoto. Hash, E, and Moto. Motorola. Okay, I hope this round was funful, and I hope you all enjoyed the round 4, 5, and 6. So with this, I'm signing off, and I'm handing over the quiz to Balam. Thank you, guys. Participants, kindly bear with us. We are just getting ready with the scoreboard.
Congratulations to Ankit Satwa, who has been repeatedly been the fastest and the correct one from the audience poll. And we have the scoreboard here. This is for round 3 and 4. Here are your scores for round 3 and round 4. Team A, Triad of Trouble, stands on the top. And for rounds 5 and 6, the scoreboard goes this way. And Team C, you are on top after round 6. Congratulations, team. Great going. And yeah, before we proceed to the next round, Tejas sir, so I want to hear it out from you. Any funny memory or an important note that you would like to share with all of us from your med school?
I'll share my recent experience of meeting Devayan sir. So I went to SAT GS and took part in their quiz, and it was very nice meeting him in person because we've always interacted in this manner in many online quizzes. Similarly, Nishit sir also, it was a pleasure to meet him. I think last year in Bhopal. So it's good to see the mutual respect and camaraderie bonhomie between students from various cities and colleges. And online platforms such as yours give us an opportunity to interact in this way.
Thank you, sir. That's great that all the co-participants are cheering up for each other. Yeah, and now I would like to welcome our host for the next 2 sessions, Balamati, and she'll be taking over for the next 2 rounds. All the best. So, guys, next round is going to be a riddles and it is going to be a buzzer round. We have shared the link of the buzzer to you on the group, right? Kindly keep it ready. Important information, if you exit that web page, you will be signed out and you'll have to, join the team, join again with the code. So keep that page ready all the time. Don't refresh that page. We have shared the link with you in the group already. Kindly get it done before we start the next round.
What's the room code?
You just open and we'll tell you now.
Any one person has to join, right? Or like all 3 can join?
Yes, one person from a team has to join in. And please try to join in with your team names. It would be better if you join with your team names.
What is the room code?
Give us a minute. I'll just share the room code on the group now.
बताइए जब आएगा तो.
The code will be shared in a while. And we are informing it again. If you close that website, you will be out of the room. So make sure one device is always on that buzzer. If you miss it once, by the time you rejoin into the room, you may lose the question and the points, and we are no way responsible for that.
Can you please share the room code again?
If you haven't shared yet, it will be on the group. Once it is on the group, I will also be repeating it here.
Okay.
Hi guys, I'm Bala, one of the organizer.
Okay. I hope everyone is able to see the room code on the screen. It is DULRXV. We request only one participant from a team to join with that code.
It is saying unable to join the room with this code.
Yeah, same.
Okay, just a minute. Can you please try refreshing your page now?
Still showing unable.
Right. Okay, we have generated a new code. If you can see on the screen.
Can you please move your cursor? The cursor.
Yes, yes. RVFCFZ.
Only five teams have joined the buzzer.
Team B has not joined in. Team B, Coldplay tickets available. Are you guys there? Yash, Gagan, Henal. Anybody here? Please respond.
Just a minute, ma'am.
Alright. Yes, Pratham, can I know your query, please?
I was asking that we have to keep this tab open all the time, or we can keep it in the
No,
background.
if you close this tab or if you're going to switch tab, you will be out of this room. So,
Then how will the person who is keeping this buzzer on, he will be able to see the question? How will he
you
be
are
able
a
to see the
team.
question?
We request you to use another device for this. You are a team. So
Okay.
it's a coordination between the teammates.
Okay, got it.
Yeah, please make sure if you exit the tab or switch tab, you will be out of this room, and we are nowhere responsible for it. I
Team B
guess
has
all the
joined.
teams have been.
Excuse me, can you just like let us check our buzzers once? Like we can make sure it's
Yeah, we have allotted a separate time for it. Finally.
Right after the rules, you'll have a minute or two to check for it.
okay. Okay.
Don't worry. Right. Guys, just give us a minute. A little technical glitches from our side. Sorry for the delay. It will be done in a while.
Yeah, we'll see the rules for riddles round.
Can you at least show the rules till then and like testing of the buzzers till then?
Okay, so here are the rules for your round 7 riddles. This is a buzzer round, and only one person from one team should log in for the buzzers. Can we go to the next slide? Yeah, so there are totally 10 riddles, and each question carries 10 marks. There is some negative marking. If a team buzzes first and don't answer the question, or they give a wrong answer, you will be awarded -5 marks. Once the quizmaster finishes reading the riddle, the buzzer will be loaded. Okay, we'll lock the buzzer until the question is completely read, and you should be answering immediately within 5 seconds once the you click the buzzer, right? Can we proceed? You can check your buzzers now. Yeah, you can check buzzing. Yes, Nishit?
It's a request, like instead of like reading the whole question, you can just like activate the buzzer directly, because everybody has a different reading speed. So like it wouldn't be like.
Yes, you should open the buzzer after
Fine.
displaying the question.
We'll display the question. We'll give you 10 seconds. And 10 seconds after the question is displayed, the buzzer will be unlocked. Is that okay with everyone?
You can just unlock it after you display the question. Why are you giving the 10 seconds?
Okay, so we'll unlock the buzzer immediately after the question is displayed, and whichever team buzzes first, you'll be given only 5 seconds. Within 5 seconds, if you don't answer, I'll read out the next team's name, and they will also have to answer within 5 seconds. Right? Whatever answer you tell first will be the final one. Yes, Nishit?
Here also like two team passes would be like considered, right?
Two
Like
team
next to who buzzed.
Yeah, two. It's not team, it's just the buzzer. Fastest fingers first.
Yeah, the next to who buzzed.
Yeah, 2 passes. Actually, we can, keep proceeding it till whichever team answers. Okay. Any other questions? If you want to check it again, we'll unlock it once again. Right?
Yes, just
Your
check it.
buzzers are open. Your buzzers are open. Okay. Fine. We will unlock the buzzer once the question is displayed. Fastest fingers first. Teams, be ready. And your question 1 is on the screen. Your buzzer is unlocked. Jai Mata Di.
Ketoconazole.
Okay. Wrong answer. Uh, who else is going to buzz it now? We'll give you 5 seconds time. 5, 4, 3, 2, and 1. No team buzzed, so no
Excuse
team is
me?
getting a point. Sorry?
Excuse me.
Yes?
I did not buzz. Mine is the capital Jai Mata Di. How are there two?
Yes. Someone other Jai Mata Di is there. This is
Okay.
not us.
Mine is the capital one.
Whoever it is, kindly leave the room. We don't have access to check it who is who.
This is
If you
not
guys,
us. We just
okay,
discussed
Priyanshu
the
and
ketoconazole. I thought Tejas sir pressed it, but we were not that.
Priyanshu and Tejas, just information. If you guys have already checked it with 2 devices, then close the tab on 1 device.
No, we
No,
have
it's not
only
me.
entered through
It's
one
not
device.
Only the
I have only entered with one
capitals.
device.
Okay, all capital letters is yours, right?
Yes, you can check because we pressed it in the previous two.
Okay, so the other one, we'll try to remove it from the room.
I think someone from the YouTube might be logged on because you displayed the
Instead of
code.
removing, just continue. Don't consider the buzzer for that thing.
No, you
Yes.
displayed the
Should we
code. So
rename
Fine.
ourselves and then enter?
Fine, no
only you.
problem. We'll just keep it here. The other teams are your names, right? Other teams, yours are right. Okay, fine. So we'll leave this as a sample question. We are not considering this. No negative marking for the first team also. Okay, fine. So we are not considering this question because the room code was displayed publicly. Somebody else have joined. So yeah. Question number 2 on your
Excuse me,
screens,
ma'am.
please. Yes, yes, yes.
Ma'am, 9 teams like in the like other players. How come it is 9? There should be 6.
One second. One second. Agam is our admin. Call tickets is team B. Team E is champs. Jai Mata Di all capital is team D. Team F, team C, and team A. The A, all those with that red mark beside are those who left the room, so they won't be considered. Okay. And the small letters ka Jai Mata Di will not consider. Is that fine with everyone? Right? Okay. So this leave this as a sample question or something. Let's move on to the next question. Your buzzers reset. Hands on your buzzers. Eyes on the screen. Buzzer reset. And the question is here. Jai Mata Di. Okay. Team C. Team C, the answer is?
Calcifile access.
Right answer. You get the full points for this question. Can we move to the answer slide, please? Answer is calcifile accesses. And riddle number 2. Scorer, please make a note of this score. Question number 2. Eyes on the screen, hands on the buzzer. Your buzzers reset. Team D, Jai Mata Di.
Is adamantinomatous craniopharyngioma.
Can we go to the answer slide? And that's the right answer. Congratulations, Team D. Can you go on to question number 3? Here's your next question for the round 7.
Hello, may I answer?
Yes, Team A, please.
Albright's hereditary osteodystrophy.
That's the right answer, and it's really great. Can you go to the answer slide for everyone? Yeah, you get a point for this question. Congratulations. Can you move to the next question, please? Buzzers reset. And here's your question. Come on, guys. Team B, Coldplay tickets available. Your answer, B. Team B.
Somatostatin.
Somatostatin is the right answer. Congratulations. Sorry, somatostatin is the wrong answer.
Move it to the next team.
Moving to the next team, Team Jai Mata Di.
Octreotide.
Creotide, it's the right answer. Congratulations. And Team B, you get negative marking of -5 for this wrong answer.
बट मैम यहाँ पे ड्रग सर ड्रग थोड़ी लिखा हुआ है एंड सोमैटोस्टैटिन रिसेप्टर एगोनिस्ट है ना मैम, आपने आगे कंटिन्यू नहीं किया कि कौन सा?
सिंथेटिक क्रिएशन है, सिंथेटिक.
It's a
Synthetic
synthetic
octapeptide बोला तो है.
Sorry.
right? Yeah.
Sorry.
All right. Can we go on to the next question, please? Here, your next question on the screen. Get ready, teams. Yeah, buzzers unlocked. Team A, your answer?
Glucagon.
Can you please repeat?
Glucagon.
Team D, what is your answer? Can I know?
Cortisol.
Cortisol. It's a wrong answer. Team F. Team F.
Sulfonylurea.
Sulfonylurea, and that's the right answer. So Team F, you get points for this question. Team D and Team A, you get -5 points each. Next question on the screen. Your buzzers unlock, and your question is: think of it. It's something you guys can guess easily. Team F.
Incidentaloma.
It's the right answer. That's great, Team F, and you get full points for this. Can we move to the answer slide? Incidentaloma. Next question on the screen, please. This is question number 7 for this round. Here's your question. Team D again.
Poems.
Poems syndrome. Okay, it's Poems syndrome, right?
Yes.
You sure about the answer?
Yes.
That's the right answer. Congratulations. Yeah. And the question number 8 for this round. Here's the question. Be quick. Team D again.
This is a thyroglossal cyst and cyst trunk procedure has to be done.
Wow, that's really amazing, and you're so quick. Right, also. Congratulations, Team D. And this is going to be the last question for this round. Your eyes on the screen, fingers on the buzzer. Come on, guys. Your question on the screen, please. Team A.
Adrenal gland.
Adrenal gland. That's correct answer. Congratulations, Team A. I hope you guys enjoyed this round. And we have a question for the audience now. Audience, you can answer this question on the YouTube chat itself. And yeah, participant audience, this is your question. I travel in groups, highly virulent and strong. In children, my effect is often prolonged. I strike with fever, causing blood pressure to fall. With purpura widespread, I leave my mark on all. A triangular gland, I do invade, causing hemorrhage and its function to fade. A catastrophic disease, a life-threatening affair. Audience, you can answer this question in the poll, in the YouTube live chat, and we'll take up the fastest answers after a while. Can we have the answer? The answer for the audience question is Waterhouse-Friderichsen syndrome, and the quickest answers were given by Ananya Shahi again, Ankit Satwa, and Kirtana. Congratulations, guys. Moving on to the next round and final round tonight. So, participants, next round, make sure you are so quick because it is going to be rapid fire. All the questions will be displayed on the screen at once, and we want you to answer all the questions within the stipulated time in an order. Okay? Just give us a minute, and the rule slide will also be displayed. Give us a minute. We'll proceed to the next round. Till then, can I have someone to engage? And yeah, apologies from our side for the delay which is being caused. Yeah, but you'll enjoy this last round. Okay, so the final round tonight, rapid fire.
So we don't need the buzzers anymore, no?
Yeah, no need of buzzer anymore. You can exit that room. Thank you for cooperating for the buzzer round. So here are the rules for rapid fire. Each team will be given a set of 6 questions, and each question carries 5 marks. Only one attempt for a question, and past questions cannot be reattempted. There is no negative marking, and 45 seconds is the time limit. We are not going to pass the question. If you you should answer in an order. All the questions will be displayed at once, but you have to answer in an order. Hope I'm clear with this. Yes, Nishad.
The rules said that the questions can be reattempted. You said it cannot be reattempted.
I'm sorry, they can be reattempted.
Okay.
Okay? If you skip a question, you can reattempt. But if you already tell an answer, you can't change the answer again. Is that clear? Yeah. Great. Can we go ahead? Just a thumbs up from your side and we'll proceed to the questions.
Excuse me.
Yes, Somnath.
Like if my teammate knows the answer, so it's not necessary he has to communicate to me and then I will say the answer. He can unmute himself and can say it.
Yeah, you can unmute and say, see, but we will be noting the order. If your teammate says answer for 4th question and you change the answer for 4th question after telling first question, you won't accept it.
Yeah. I mean, the question's first answer will be considered, but he can say, right? I mean, because we are not together, so it's difficult to
that is fine. We'll accept it.
Yeah. Okay.
Any other questions or doubts from your side?
I did not understand this thing about order.
So,
we
like
can
6
answer?
questions will be there. Let me come again. 6 questions will be there. If you don't know the answer for second question, you can skip that and go to the third one.
And then, but we can come back later. No?
You can come back and answer the second question.
Okay.
The
Okay,
questions will be shown all at once or one by one?
Yes, all at once. And for few questions, we have an image. That image will be displayed for 5 seconds after the first 5 seconds. If you want to see that image again, you can request us, so we will be showing it again.
Okay.
Okay? Am I clear to everyone? Hope we can go ahead. Can we move on to the questions, please? Can we go to the questions? Yeah. Team A, you get to choose first one.
कौन सा लेना है?
Matchstick.
ठीक है, we'll go with matchstick.
Okay. Let's see the question for Team A behind the matchstick. And the time limit is 45 seconds. Please keep that in mind. And your time starts now.
The question is not visible.
Questions are not there.
Questions, yeah, here are the questions. Right, here are the questions. And that is the image if you want us to show it.
First one is the C cells.
Third one is 21q11 gene.
5 is pulmonary hematoma, paraganglioma, and GIST. Second is IGF-2.
Fourth one, mifepristone.
Sixth one आ रहा है क्या?
देख रहा हूँ.
Second one है HCG का ना?
Second one बोल दिया.
HCC. Hepatocellular carcinoma.
HCC.
Hey, your time is up. Yeah. Okay, so answer for the first question is parafollicular C cells. You answered it as C cells. We are giving point for that. Name of the hormone. Yeah, here are the answers. And
three right है ना?
Team A, you have answered 3 questions right. Congratulations, Team A, and that was very quick.
Which 3? Excuse me. Which 3 have they answered correct?
Which 3 is
1, 3 or 5?
1, 3 and 5.
In 5 you said pulmonary hematoma, not chondroma.
अरे वही होता है.
Hematoma is of tuberous.
But in the third question, you didn't mention the gene, you mentioned the chromosome. So
Participants, just a minute. Participants, just a minute. You're supposed to address us, not your co-participants. Right?
Excuse me.
Yes.
In the third question, they answered the chromosome, not the gene, and gene was asked. So, like, can you check?
Give us a minute. Okay, so they did not answer the gene name. Will not consider answer 3 also. Only 2 answers go right for Team A now. Okay? That's a great one, Team A. And can we move on to the next question for Team B? Team B, which image would you like to choose?
Burning tree.
Burning tree. Okay, let's see what is the question. So, Team B, here are your questions. And your time starts now.
adrenal cortex derivative mesoderm medulla neural crest cells. फिर first का फिर the half life of iodine 131 is 7 to 8 days. Name any two agonists of the secretion of chimicone. Most common cause of primary bilateral micronodular hyperplasia of adrenal gland with receptor found abundant in theca internal cells. थीका इंटरनल LH के ही होते हैं ना, LH थीका इंटरनल LH के ऐसे LH फिर आइडेंटिफाई द
Time, sir.
पता नहीं यार.
Time, sir.
That's a great move, Team B. So can we go to the answer slide, please? So you have answered question 1, question 2, question 3, question 4 you told 7 to 8 days. And yeah, so you get 4 questions right for this round. Congratulations, Team B. You are so good. Can we go to question for Team C? Yes? Did anybody call me? Yes, Medansh, do you have any question?
No, it is not me.
Alright. So can we go to question for Team C? Team C, men SX
Volcano.
volcano. Okay, let us see what is behind the volcano for Team C. And your questions on the screen. Your time starts in 5, 4, 3, 2, 1. Yes.
One is false. Can you
Can we have the image, please?
erythropoietin and renin? Second. Acarbose, alpha glycosidase inhibitor. Fourth is calcium sensitive receptor action कदाच. Fifth is calcium sensitive receptor. Sixth, can you show the
Time,
image?
sir. Time, sir. Sorry, time, sir.
Okay, Team C. So you have answered question 1 right. Question 2 is also right. You haven't answered question 3. For question 4, we wanted drug names.
I said acarbose.
Yeah, we are giving you the point for that.
And I also said calcium sensitive receptor.
Right, we are giving you point for question 4 and for question 5 as well. So 1,
Okay,
2,
thank
4 and 5 are right.
Like, it's a request. Like, can we leave the quiz because our dinner is pending? So,
So this is the last round.
yeah,
And
but like our turn is over and no more passing. So can we just leave, please?
you can just wait for the results. It will not take more than 15 minutes.
Okay.
Right? Yeah. Right. Can we go to Team D now? Team D, which
The
question?
agarbatti, the incense sticks, the third image.
Incense sticks, third. Okay. And here's your question for Team D. Your time starts now.
One is parathyroid gland. Can you please remove this?
Yeah, we are removing.
2 is IGF-1 and it is called somatomedin C. UTIs, SGLT2 inhibitors, the भाई unmute करके बोलना. Fifth is erythropoietin and prolactin. Thyroid imaging.
SGLT में
empagliflozin, canagliflozin,
Glyphosate.
dapagliflozin in 4. And TYRAS is thyroid imaging, radiology and data system.
Time, sir.
That's great, Team D. Have answered 1, 2, 4, 5, 6 correctly. Yeah. So you get 6 Oh, okay. For the sixth question, it is thyroid image reporting. You told it as radiology, so we won't
Sixth
give
is
point
wrong.
for that.
We
Yeah,
did
sixth
it.
is wrong. You get points for 1, 2, 4, and 5. Congratulations, Team D. Next, can we go to Team E? Team E, which image would you like to choose?
We are going with the campfire.
Campfire, okay. So, Team E, here are your questions for the last round. Your time starts now.
Second one alpha hydroxylase.
कशिंग नाही आवडतो ट्रीटमेंट जो कशिंग डिसीज मासू रिसेक्शन anti-estrogen inhibition bipolar manic disorder condition यार
Surgical treatment would be adrenalectomy.
Time's up.
So, Team E, you haven't answered one question also.
They've answered question 2.
One alpha hydroxylase.
Yeah, you have answered answer 2, right. So, only one right answer for this round. That was a very good try. Can we move on to the last question of the quiz? Question for Team F. Sorry, team, you have no option. And your question on the screen. Your time starts now.
Question 1, superior, middle, and inferior thyroid veins. Question 2, neurophycins. Question 3, question 4 is nasolin. Question 5 is National Institute for Developmental Disabilities and Child Protection. And question 5 is tertiary hyperparathyroidism.
Question 3 is primary
Time's up.
hyperparathyroidism. I told before you told.
Question
Primary
3, primary hyperparathyroidism.
Okay. Can we go to the answer slide, please? So, Team F, you have answered 2 questions right. Second question number 2 is right. And 6th question right. So, you get 2 points for this. Well done, Team F. And yeah, with this, we come to end of the quiz. Well played, all the teams. That was great. And give us 2 minutes. We will display the scorecard, and the winners will be announced. Till then, we would like to hear the feedback from the participants. We would like to hear it from you. Your mistakes or whatever you liked in this, everything. We would like to improve it for our next event. I would like to hear it from every one of you. Okay. Can I hear it from Jeff, sir? Yash Ratwani from Team B, can I hear it from you? How was your experience? What did you like in the quiz? What did you not like? Whatever. We would like to hear it back from you people.
That was a good experience. Was a bit unlucky here, but okay. Learned everything new. So yeah, thank you.
That's nice to hear it from you, sir. We have Dhruv here. I don't see him here. Uh, okay, Tejas, can I hear it from you, sir? How was the
I
experience?
I enjoyed the buzzer round because that gave us a feel of an actual offline quiz, and the clinical cases were okay. Also, I liked the initial connects, but I'm not such a big fan of the dumb charades type connects. And also, I would suggest you to keep pounds for the next time. So we can message the answers and it can be open for everybody.
Sure, sir. We'll actually note this point. We'll try to include it in our next upcoming events. Can I hear it from Gagan?
Yes, our experience was good. Felt a bit unlucky in two or three questions and learned a lot new things.
Thank you. Can I hear it from Priyanshu, sir?
Hello. It was a great experience. There was a bit issues with organizing the round two that I found very not good as the other rounds. That Cascade round was very interesting. It was nice to see the questions in that, and the quiz was balanced, but it took so much time. So it would have been a shorter quiz with some deciding questions like the some rounds like Damshara's round were everyone was answering, so it would have been removed. Like it didn't create a difference.
Right. Thank you, sir. Thanks for the feedback, and we'll take it all. We'll definitely use it for improving our upcoming events. I think only Mohank Agarwal is here from Team A. Can I hear a few words from you about your experience and your feedback?
Yeah, my experience was good. The first few rounds were a little bit sluggish. They could have been a little bit more quicker, but that's fine. I did not expect the dumb charades round to be there. That was good. That was a good initiative, basically. And the cases were also like good, and I learned a lot about surgical aspects of endocrinology today. So yeah.
Thank you, sir. That means actually it's motivating for us. Yeah. Thank you for the kind words. Can I hear it from Somnath?
The quiz was very nice. I also didn't like the dumb charades one personally. I like where connect the dots. Like the first section was good. Like the connect the dots, like where you had to logically had to correlate. And I like the buzzer round a lot. It was really fun, and rapid fire also was very fun, and it was a very fun experience for me. Like so, thank you.
Okay, so that was great to hear from all of you. We'll definitely take all your feedbacks. We'll keep in mind while preparing for our next event. And I would like to take a moment to thank the organizers of this quiz for giving us all the opportunity. We have been planning for this quiz for almost 3 months. Yeah, and we are happy that it came out well. You people enjoyed, you learned, and yeah, we know there are flaws from our side also, but Everything makes sense when the participants tell they enjoyed the quiz. The quiz questions were standard. Yeah, a very big team had to work behind this. Thank you all for your support, and I think the scorecard is ready. Um, in a while, the scorecard will be displayed and the winners will be announced. As said earlier, the winners will get a cash prize of 5,000 rupees. The first runner-up will take home 3,000 rupees cash, and the second runner-ups will get 2,000 rupees. The winners will also get books sponsored by JP Publications. Thank you, JP Publications, for sponsoring us book for this Endocrinowiz. And yeah, if you guys want to speak anything, stage is open to you all. You guys want to interact, then it's also fine. So now I would like to take a moment to speak a few words about Agam. Um, hmm. So we would like to hear a few words from our audience who are watching us live on YouTube. Audience, can you please put it down in the chat about your experience? It would be great if you could provide us with some feedback. So about Agam, it is a group of medical students who came forward to build a student-friendly community to incorporate all the fellow medicos where we can learn together, interact together, inspire each other, and enrich ourselves for a better future. And I feel so grateful to be a part of this team. And now that the scorecard is ready, we'll announce the winners now. Can we have the scorecard on the screen? Yeah. So at the end of round 7 and 8, these are the scores. Congratulations, team. All of you have done a very great job. Congratulations, Team D, Jai Mata Di, Tejas, and Priyanshu. You guys were really quick. You guys are really inspiring, and yeah, you were on point. Congratulations to all the effort and your hard work. First runner-up is Team C, Men SX, Nishit Takar, Dhruv Darji, and Heath Prajapati. Congratulations. And the second runner-up is Team A, Triad of Trouble, Dabyan Banerjee, Malhar Deshpande, and Mohak Agarwal. Congratulations, team. Congratulations to the other teams as well. You guys were great. And we hope to see you in our future as well. Thank you all for joining in. Thank you all for showing your
Excuse me.
enthusiasm. Yes, sir.
Thank you for the wonderful event. I just had a small query. How would you be giving us the cash prize? Online
So we'll contact you through WhatsApp regarding all the details.
and the books? Okay.
Can you please
Yes,
show the
everyone will
scoreboard
be
again?
contacted.
Can you please show the scoreboard again? The
Okay,
final
can we
one.
go back to the scoreboard? Yeah. Just a minute. Here's the scoreboard.
Thanks.
Yeah, thank you so much. Congratulations, winners. We respect your efforts. And yeah, hoping to see you in our future events as well. Thank you for participating. Thank you, Agam, for this opportunity. Thank you all. Have a great night. Thanks to the YouTube audience who have been with us for this long hours. And congratulations to all those winners. Ankit, you are one of those fastest person who answered almost all the audience question. Thanks for the enthusiasm and all the very best. With this, we come to end of our Medmaze Endocrinowiz presented by Agam. Thank you all.